In this presentation, I would like to talk about male sexual function issues, what they are and what their symptoms are. I would like to draw your attention to erectile dysfunction and when it's time to get worried and go and do medical checkup, and when it's time just to relax and take it easy. I would also talk to you about why you should never resolve your sexual function issues with medical professionals and what are the immediate steps you can take in order to improve your sexual health and well-being. Male sexual function issues include erectile dysfunction, premature ejaculation, delayed ejaculation, problems with sexual arousal and drive, and orgasm. And I'm going to talk about each individual issue separately in my next videos. However, here I would like to draw your attention to erectile dysfunction in particular. Remember that erectile dysfunction can happen to any man at any age and at any period of his life. And if you noticed that it accidentally happened to you, the first thing to do is not to panic, because it can get things worse. If you start thinking about it too much and if you start to panic, it might minor issue might develop into something big. So the first thing that you need to do is to check if there are any contributing factors in your life that are currently present and that can potentially affect your sexual health. And we're going to talk about these contributing factors in a minute. But what is important is to see if the following symptoms are present for the last 6 months, and then it's time to go and book an appointment with a medical professional. So the following symptoms that you experience, either one of them or all of them for the last 6 months, and you experience them regularly, then it's time to go and check your general health, because that could be the reason why the symptoms started to happen. So the first one is that you struggle to obtain erection during sexual activity. And it didn't happen once, it's happening on a regular basis. If you struggle to maintain your erection during sexual activity until it's complete, and if you notice that there is a significant decrease in erectile rigidity during sexual activity, so if these symptoms are present in your life for the last 6 months, then it's time to book an appointment with a medical professional. If you started to experience sexual function issues related to erectile dysfunction, the first point of contact should be a medical doctor, but only for the purpose of eliminating any medical conditions. Remember that medical doctors are not trained to resolve sexual function issues without any medications or without any surgical procedures. And a lot of sexual function issues do not require medications. Unless medical doctor is trained psychosexual therapist as well, there is no need to go and resolve your erectile dysfunctions with medical doctors, because quite often you can cause more damage to your health, more damage to your sexual life than before. So if you went to medical doctor, you run all the blood tests, necessary blood tests, all the general health checkups, and everything is normal, everything's fine, but you still experience erectile dysfunction, then the next point of contact should be psychosexual therapist. And please pay attention, not psychologist, not psychiatrist, not general counselor, but psychosexual therapists, because these are the specialists who are specifically trained to resolve sexual function issues without any medical intervention. There are two types of erectile dysfunctions. First is primary erectile dysfunction, and second is secondary erectile dysfunction. Primary erectile dysfunction is the condition when man never had erection since the age of his puberty. He never was able to participate in sexual activity or have solo sex or masturbation because his erection was never there. It's a very serious form of sexual health issue and of course requires medical intervention. The most common one is secondary form of erectile dysfunction, when men never had problems with erections, always had fantastic or adequate sexual activity, and then something happened and started to experience erectile dysfunction. What is important to understand is that especially if you have secondary form of erectile dysfunction, in most cases it is possible to treat it for full recovery. And like I mentioned before, the first point of contact should be medical doctor in order to eliminate any medical contributing factors to your condition, because your reproductive system and your cardiovascular system are very connected. And if suddenly, out of the blue, you started to experience problems with erections, maybe it's time to go and check your heart, because there could be an underlying cause for future stroke or even heart attack. Because the arteries that surround your penis are so small, so fragile, and so sensitive to any changes in your body, to any problems, that they could feel first that there is an upcoming problem before it's even spotted or diagnosed on a bigger level. Another quite important thing to remember is that erection problems could indicate the upcoming diabetes at its early undiagnosed stage. So maybe it's time to go and check that as well. When you go and see a medical professional, they will run a number of required tests, blood tests, including your androgen testosterone level, because testosterone is male hormone that is responsible for sexual drive, for sexual arousal, for sex, and also for erections. So drop of testosterone might indicate that there are general underlying problems in your body, and of course drop of testosterone causes sexual function issues. Your brain plays an essential role in your sexual activity, because your brain decides when and how you're going to have sexual activity or not. And of course, if there are any problems with brain, say if you experience any brain injuries, or maybe tumors of the brain, or maybe multiple sclerosis, it can cause problems with erection. Parkinson's disease can cause problems with sexual activity and erection. Peyronie disease. Peyronie disease is when there is curvature of the penis happens, and the reasons, the causes of Peyronie disease are still under study, not known why Peyronie disease happens. However, Peyronie disease can cause very painful erections and can affect erections significantly. Prostatitis, that's the inflammation of prostate gland or area around it, can affect erection. Any in surgical interventions with prostate gland, especially when it comes to cancer or any kind of procedures or surgeries, can affect your sexual activity and the erections. Testes and testicular abnormalities, any intervention in that area can affect your sexual health and erections. And there is a condition called hypogonadism. That's when there is a testicular atrophy, and due to the low production of testosterone, there could be changes in masculine sexual characteristics. So it's very important to go and see medical professional regarding that, because that can affect your erection quality. Remember that your spine is very important in order to provide that connection between your brain and your penis. So any injuries to your spine, especially to those areas that are especially responsible for this connection, can cause problems with erection. So if, say, you underwent spinal surgery, or if there was some accidents and there was some damage to the spine, and suddenly you started to experience problems with erection, it could be the cause of it. Remember that there could be some symptoms of possible organic causes, like penile foreskin conditions, like phimosis or lichen sclerosis, or maybe urinary tract symptoms. There could be some problems with infections, sexually transmitted diseases or HIV. Chronic kidney diseases can affect erection. Also, any surgeries related to pelvic floor or abnormalities of pelvic floor can cause erection problems. Weakness to pelvic floor can cause erection problems. And of course, obesity. When there is a problem with weight, there is a problem with hormones, and of course the digestive system. So it's worth looking into it, because if you see that you are gaining weight, then there is imbalance in your hormonal system. So it's time to do something about it. And of course, the biggest killers of all of this are stress and fatigue. So we're going to talk about this a little bit more in the next slide, but I want you to draw your attention to this. If you're currently under a lot of pressure, a lot of stuff going on in your life, there is high level of stress and anxiety and tiredness, that could be the main reasons, not just for erection problems, but for other health issues that could happen later on in life. Like I mentioned before, erectile dysfunction can happen to men at any age, starting from teenage and finishing with mature men at any period of their life, at any stages of their life. And erection problem or erectile dysfunction can be looked at as a separate problem, or it can be a combination of other sexual function problems. So it could be erection disorder together with premature ejaculation, or erection disorder with the loss of libido. What happens during erectile dysfunction? The blood is not pumped sufficiently to the area of penis where it normally should be during sexual arousal and sexual activity. And even if it's pumped there, it cannot stay there for the length of sexual activity for one or another reason. And obviously, we look into each individual case separately. And there are different scenarios that men can experience erectile dysfunction. Remember that erection and ejaculation, they are two separate processes. Because they quite often happen at the same time, people believe that if you had erection, it means that you have ejaculation, and it means that you had orgasm. But they are two separate processes, because you might have erection, but you might not be able to ejaculate, or you might have erection and orgasm, but ejaculation won't happen, or you might not have erection, but you will still be able to ejaculate, or you might ejaculate but don't experience orgasm, or you might experience orgasm but do not ejaculate. So there are lots of different scenarios that can happen, and again, each case is looked at individually. One of the biggest issues that the majority of men experience when they come for therapy, psychosexual therapy, is fear of failure or anxiety during sexual activity, because anxiety, stress, they are the biggest killers of erection. And there are different scenarios when you can experience this erection problem. So you might want to engage in sexual activity. You might want to make love to your partner, but your penis doesn't, and you don't experience erection at all, and you cannot have sexual activity. You might get excited, you might get erection, but as soon as you know that sexual intercourse is about to happen, you will lose it. Or what also can happen is that man might have erection, he might engage in sexual intercourse, but he's not able to maintain erection until sexual intercourse is complete. So he has to finish it with hand or orally. Sometimes men can have erection if he's closed, but as soon as he's exposed, his erection goes. Men might be excited and have very strong erection, knowing that sexual intercourse will not be possible, but as soon as he knows that sexual intercourse is about to happen, he might lose erection. Men might have erection only in situations where a woman dominates, or to the contrary, as soon as he sees that woman dominates, he might lose his erection. There could be a total erectile disorder, so in any possible conditions, situations, men cannot have erection. Or, for example, it could be erection problem only in specific circumstances. So say a man might have erection with a casual partner, but he can't have sex with his permanent partner. Or to the contrary, he might have problem with his partner outside his marriage, but won't have problem with his permanent partner. So all of these scenarios were looked at individually, and once the causes, the contributing factors are established and defined, then there is a specific treatment plan to improve the condition, to control it, or to heal, to resolve this problem for good. If you're currently taking any medications or drugs that are to treat other medical conditions that you might experience, it's worth looking at this list presented on this slide and see if any of them are on this list, because they could contribute to your erectile dysfunction issues if they are on this list. So it could be antidepressants, they could be hormones, they could be histamine, or recreational drugs or a number of other drugs and medications that are presented on this list. So if you don't have any medical conditions, you're a healthy person, your blood tests are normal, but you still experience erectile dysfunction problems, then it's worth looking at the psychological part of the problem, because there are psychological contributing factors. And one of them are stress, anxiety, and fatigue. These are the killers that I already mentioned. They are very detrimental to your sexual health, and it's important to look at what's going on currently in your life, because they can also create conditions for future illnesses, for future problems, not just with your sexual health, but with your health and longevity in general. One of the biggest problems and quite common problems that a lot of male patients and clients come with is fear of failure, fear of performance anxiety. That's why I mentioned at the beginning of this presentation, if accidentally you experienced problems with erection, the most important thing is not to think about it too much, is not to panic about this, because it can cause that performance anxiety. It's like a vicious circle. Every time before sexual intercourse, you will be thinking about this failure, and every time it will start happening again, because your brain is not involved in the process of sexual activity. Your brain is occupied with a completely different thing, and it's basically the time when it's important to go and see psychosexual therapist, because only professional will help you to get rid of this problem. Fear, shame, guilt, these are very negative emotions that can contribute actively to the problems, because they increase the level of anxiety and also anticipation of punishment for one or another reason. There could be very deep psychological issues that maybe you experienced when you were a child, or maybe you experienced in specific situations. Also pressure of sexual demands, not just from your partner, but from yourself as well, because of some conceptions or misconceptions or prejudices, requirements that sometimes you might even created yourself, unrealistic expectations from yourself as a man, and that can put a lot of pressure on you and cause erectile function problems. Inability to surrender to sexual feelings and constantly being in your mind, constantly thinking, that could be a contributing factor to erectile dysfunctions. There is a phenomenon called nice guy syndrome. Unfortunately, a good amount of people suffer from that. It's when you try to be nice to the outside world, because at a certain point of your life you were promised that if you are nice to the world will be nice to you. And unfortunately, it's not the case when we talk about reality. And it's a very complicated and multi-layered phenomenon that you need to work with professional, but it can be a contributing factor to your erectile dysfunction, because there are lots of unresolved conflicts, lots of suppressed emotions, lots of anger, lots of disappointment accumulated there. And that passive aggressiveness, that passive kind of wish for revenge, that hatred, disappointment, frustration caused by women can be expressed through erectile dysfunction. Of course, problems in relationships can cause erectile dysfunctions, negative thinking, self-esteem and confidence issues, and obsessive thoughts, compulsive behavior when your sexuality, your sexual parts are used in order to maybe release stress, diminish anxiety. So you're not looking at your body as a gift, as a part of you. You are basically using your body, abusing your body as a tool in order to achieve specific goals, especially when it comes to releasing that very high level of tension and anxiety. And of course, there is a phenomenon called fear of castration. That's again very deep psychological issue related to your childhood traumas, relationships with father, relationship with women. I noticed from my experience that there are a lot of men who are currently living with their moms at the age of, say, 40 or 50 maybe. They experience erectile dysfunction problems because there are lots of suppressed emotions, suppressed anger, unresolved conflicts, aggression, and of course an ability to prioritize yourself. So all these psychological factors, these are kind of like most common one, but the list is not exhaustive, and each individual case we look at individually. If you found out that you have erectile function problems, then there are a few things that you can already do immediately without anybody's help. And first of these things is look at your life. What it's like. Is it full of negative emotions, or is it full of stress? There is a lot of pressure, anxiety there? It's important to kind of look into it and to take control over it, because these negative emotions, negative events that's happening in life, the tension, amount of tiredness, they contribute to your sexual well-being. And maybe it's time to change something in life. Maybe it's time to go on holiday, or maybe just take a rest and relax. And it's important to practice mindfulness. Mindfulness is all about control of your emotions, control of your thinking, control of your engagement in the process, in the activity, how present you are in what's going on in your life. Are you able to enjoy your life to the full, or are you constantly thinking? Are you constantly under that pressure, under that stress, under that, anxiety? Another quite important thing is to look at your lifestyle, at your diet, at your nutrition. Increase your physical activity, because physical activity will improve the level of testosterone. And of course, how you eat, how you manage your day, how much water you consume, it's all part of the healthy plan for improvement of sexual well-being. I also recommend to my clients to do digestive system cleans, because digestive system is the area where your body drinks from and where your body eats from. It takes essential vitamins, essential food. And of course, if it's not in a good condition, then you can't talk about healthy functioning of your body, including your sexual activity. Relationships. What type of relationships are you currently in? Are you happy in your relationships? Or if there are any problems in relationships? Obviously, relationships play a vital role in your sexual activity. There is needless to say that if there are problems in relationships, it's quite hard to enjoy your sex life. Working on your masculinity, working on your values as a man, working on your self-esteem, confidence, boundaries, quite important because they all contribute to the way you feel about yourself, and the way you feel about yourself will definitely have effect on how you perform, including sexually. Also improve your sex education, because education, including sex education, will increase confidence, will diminish all those negative emotions like fear, like anxiety, like shame, like guilt. And remember that sex, it's not limited to erection or non-erection. Sex is very diverse, it's multi-layered, multifaceted. And in order to have high quality sex, not always erection is important, because hard erection doesn't always guarantee high quality sex. Pelvic floor training for men, important area to look into, because pelvic floor muscles play an essential role in your sexual activity, in testosterone production, in kind of, level of erection that you have. So with the right approach, with the consistency, with the regular training, there are a lot of problems that you can avoid and prevent and resolve if you do pelvic floor training for men in the right way and regularly. And of course, I would highly recommend to go and take a few sessions with psychosexual therapist, because having sexual function issues for men is quite detrimental. It's the level of humiliation, the level of frustration is out of limit. And remember that your longevity depends on the quality of your sexual health. So there is no need to suffer alone. Remember that there are specialists who are trained in this area specifically to help people like yourself to resolve these issues. So stop suffering on your own. Don't be ashamed to get in touch, because all the sessions, they are strictly confidential, they are private. Nobody will ever find out that you had this problem and that you needed help from psychosexual therapist. There is no shame to get in touch with specialists and ask for advice, because that's when you need it, and that's when you can be given solutions that can sometimes be not that difficult, but they can be obstacles to your healthy life. So what's the point of sitting there on your own, beating yourself up, suffering in silence, avoiding good stuff in life, hiding from relationships, if you can resolve it and get back to normal life without any delay? For any more questions, please contact me on www.londonpsychosexualtherapy.co.uk. And if you like this video, please click like.